You're looking at here is an MRI image of a 33-year-old patient who had over 12 cc, which is 12 syringes of hyaluronic acid filler injected to her face over the past 6 years. Now the area that is green is the hyaluronic acid filler. Now, what's interesting here is that when we did volumetric analysis, that means when we measured the amount of filler, the amount of volume that was there, it ended up being close to 28 cc, which is more than twice the amount of filler that was injected.
Well, let's talk about this controversial video about fillers. It's all over social media and there's nothing demure or cutesy about it. It shows a patient who is 32 years old and has had filler in her face, 12 syringes, and 6 years later, it's 28 cc's volume-wise in her face. What's going on? The practitioner didn't inject 28 cc's of filler in her face, like some videos suggest. It's that hyaluronic acid fillers will draw in water and hold them in your skin, and we actually like that property if used properly. The other controversy in this video is that fillers are apparently supposed to last 9 months, maybe 12, 18, and people are confused as to why there's still filler in the face 6 years later. Well, the truth is that filler can last a long time, decades even, and most experienced aesthetic professionals know this and inject accordingly. The filler companies have put on the box of the filler that the filler lasts 6 to 18 months, and this is based on their estimation as to when the filler breaks down. But like many drugs and many devices, how they operate in the human body and what happens in the human body is very different from what happens in the lab. And that's why it's important to work with a physician or someone who has a medical or scientific background who thinks about these issues critically and thinks about the patient in front of them instead of just accepting what's on a box. In our clinic, we don't inject any fillers in anybody's face until we assess the patient's face sitting right in front of us, not based on the fact that we did lip filler 6 months ago, so it's time for a top up. We look at the patient and say, do they need any volume? Do they look good? And what can we do to make them look their best at this point? We also know that fillers are very, very hydrophilic. They draw in water, and different fillers will draw in different amounts of water. So depending on where we want that effect maximally, we inject accordingly. We're not going to use hydrophilic fillers in the lips where they're going to swell and it's right at the surface and it's going to look really bad. We also don't do a lot of tear trough filling in the first place, but if we do, we don't use fillers that draw in a lot of water. So these are some of the nuances and the consideration that one has to take when they're using fillers, and experience is key. There's nothing that beats that. So when you're looking for someone to help you with your aesthetic choices, make sure you're working with someone who's used filler, Botox, whatever they're injecting for a long time, and they think about these things critically and don't just accept what the manufacturers tell them.